LeBron James appears to have some sort of strange looking fluid sac in the back of his left knee. What in the world is this? And is it possible this is the cause of LeBron's ongoing knee issues? Welcome back, everybody. I'm Dr. Brian Sutterer, and this is your #1 source for learning about the unique medical side of the world of sports. LeBron has, of course, been dealing with swelling in his left knee, leading to all kinds of speculation about what's going on. And hat tip here to Dr. Evan Jeffries on Twitter, who noticed on this highlight clip this almost kind of weird accumulation, almost looking like a little fluid sac, as he described it, in the back of LeBron's left knee. And this was, of course, the last game he played against the Brooklyn Nets. Now, sure enough, as LeBron is going up for this insane windmill dunk, you can see there's this very clear focal area of swelling on the back portion of LeBron's knee. It appears to be mobile. As he jumps, activates those muscles, it looks like it shifts. It looks like there's potentially some fluid in there. Understandably, this has people kind of freaked out, wondering what in the world is going on with LeBron's knee. And I think there's actually pretty simple explanation for what it most likely is. The most common cause of when we're seeing somebody with swelling in the back of the knee is going to be something called a Baker's cyst, or more technically, a popliteal cyst. With our biodigital anatomy tool here, we're looking at the backside of a left knee. So I'll zoom out a little bit to the entire leg. Here, of course, the front side of the knee, spin around to the backside. This is going to be the posterior or backside of the knee. Now, we call this area the popliteal fossa. It's this area in the back of the knee where the popliteal vessels run. And so that's where we get the name popliteal cyst. It's just been given the eponym of a Baker's cyst. In this area, the back of the knee, on the inside, we have the semimembranosus and semitendinosus. So two of the hamstring tendons coming down on the inside of the knee, inserting down on the tibia. On the outside from above, we have the biceps, another one of the hamstring muscles coming down, inserting on the fibula. And then we have the origin of the two heads of the calf muscles coming off of the inside and outside portion of the femur. A Baker's cyst or a popliteal cyst is swelling that originates from the knee joint that pushes back out into this posterior aspect of the knee. Now, typically it's going to occur right at this junction between the semimembranosus tendon and the medial or inner portion of this gastroc. So sort of right in kind of this area is where, when we look with ultrasound MRI, it'll tend to come forward. Now, sometimes when it comes forward, it can get big enough that it kind of accumulates in the whole back side of the knee, but generally we tend to see them more on that inner portion, right at that spot. Next, we'll talk about what causes these and how we treat them, but first I want to give a shout out to the sponsor of this video. Today's video is sponsored by Collar, a performance menswear company that is honestly the only shirt that I'll wear when it comes to dress clothes. It's no secret that I'm a huge fan of these shirts. Pretty much every single video you guys see me do, I'm wearing something from Collar, one of their shirts, one of their ties. They're just that comfortable that I don't want to wear anything else. When you hear their shirts are made from recycled plastic bottles, it sounds like there's no way it would be comfortable. But believe me, it almost gives it this kind of really lightweight athletic wear type of feel that's extremely comfortable, wrinkle resistant, and even stain repellent. I'm typically more of a patterned shirt type of guy, but they also have plenty of just solid colors and even short sleeve options. Finish out your wardrobe with ties, socks, and even pants and shoes. Click the link in the description below and use code Brian10 to get 10% off your first purchase. Believe me, you're never going to want to wear another dress shirt. So help support this channel while upgrading your wardrobe to something more stylish and comfortable. Thank you again to Collar for sponsoring this video, and let's get back to our learning. These Baker's cysts most often relate to some underlying damage or trauma within the knee joint that causes an accumulation of fluid or swelling in the knee that really doesn't have anywhere else to go and kind of outpouches into this cyst collection that extends into the back of the knee. The one atypical thing about this for LeBron is that it seems like it's a little bit more on the outside or the lateral portion of his knee, as opposed to more on the inner side. But to be honest, it could be significant enough that it's just kind of extended over there. When he goes up into this jump, it seems to be a little bit more centered right in the middle of his knee joint. As he kind of comes through here, you can actually catch a little bit of the outline or kind of contour of his biceps femoris, that hamstring muscle kind of coming down right here. And then as his knee goes up into more flexion, you can see how it still stays pretty centered within the joint. So it's not like it's continuous with those hamstring tendons as they come to wrap around on their insertions on the tibia. Similarly, it doesn't look like it would be originating from the joint where the fibula meets the tibia, because that's going to be further here on the outside. And then as he's coming back down from the dunk, again, we can see a little bit of contour of that biceps femoris with that kind of focal area of swelling kind of right there in the back of the knee. In medicine, we always think about the differential, so other things that could cause focal swelling, and there's certainly a lot of bursa around the knee where the tendons kind of insert onto the bone. It would be very unusual to see a significant enough bursitis in the back of the knee, especially because this isn't centered really on one of the hamstring tendons. So I would have that very low on the list. Certainly sometimes people just have really abnormal anatomy with different kind of accessory heads of different muscles. So maybe that's what we're seeing here, but I think those are pretty darn low. We have to remember again that the Lakers admitted that LeBron has fluid on this left knee. And when you have fluid, you can have a Baker's cyst. So things kind of go hand in hand and would fit from that perspective. Baker's cysts can be extremely challenging and tricky to manage because they have a high tendency to come back. Generally, when one first occurs, the number one question we ask is, where is it coming from? What is the source of the fluid? Typically, the source of the fluid is from some sort of trauma or damage to the joint, whether it's the cartilage like arthritis or something like a meniscus tear. So number one, you have to think about what's the underlying cause of that fluid accumulating to cause that collection in the cyst. Then to treat it, if it's significant enough, we can actually put a needle in the skin, drain the fluid out, and then put something like cortisone or an anti-inflammatory in the joint to try to calm down the inflammation. But oftentimes those cysts can come right back. In those cases, we can do specific procedures where we inject sclerodecing agents such as doxycycline to basically go into that cyst and kind of scar down the lining of the cyst to get it to stick together and adhere. But sometimes you have to do this multiple times because these things are just so darn stubborn. Sometimes they even get to the point where you have a surgery to try and go in and actually tie off the neck of where that cyst fluid is coming from. So they're not necessarily as straightforward of a thing as just having fluid on the joint. It certainly takes this up a notch in terms of complexity. So anytime we see swelling around a joint that doesn't seem to be spread around the entire joint, but more isolated to a specific area, we think about these ganglion cysts or these collections of fluid that come from the joint. When we see one in the knee, we call that a Baker's cyst or a Popliteal cyst. And really to treat it, you have to think about where it's actually coming from in terms of what's causing that fluid to be produced to then accumulate within that cyst. These things are extremely easy to diagnose, and so all it would take is a quick ultrasound or an MRI to pick up if that is in fact what's going on here with LeBron. Other things, of course, to think about on the differential, like I said, maybe an odd presentation of a bursitis with some fluid collection, but I think very unlikely. Of course, you can always have things like lipomas, which are just benign collections of fat that can form below the skin. Or maybe this is just his normal anatomy where he could have an accessory muscle head to one of the gastrocs or something just with the contour of his hamstrings that's causing him to give it this appearance. But overall, definitely something unique, something a little bit unusual just seeing here, and putting things together with the swelling on his knee, I think there's a good concern that this is something like a Baker's cyst. That's it for the video, everybody. Let me know as always any questions or comments down below, and until next time, we'll see you later.